Hello and welcome to LA Currents. I'm Anita Bennett. There are many changes underway in Council District 10, and the man who represents that area, City Councilman Mark Ridley-Thomas, is with us today to discuss some of the important issues making headlines. Thank you so much for being here.
Delighted to be here.
All right, let's get started. Let's talk about COVID. You spearheaded the ordinance that just passed in the City Council mandating that city employees get vaccinated. Why now, and why did you help lead that effort?
Well, Anita, it's very, very clear that the Delta variant is pressing its way in a manner that we cannot take for granted. That means that because the vaccination rate is below what we need in order to reach herd immunity, way below that, and because we have the strength of this variant, which is twice that of COVID-19 in its original form, we had to do something. After all, public employees are to serve the public, not put the public at risk, whether you're a firefighter, a police officer, a librarian, whatever the case may be. Whether you work in the parks, you have to be healthy. Nothing unusual about that. You can't be a spreader. There's an obligation there, and at the same time, you have an obligation to your coworkers not to make them sick. And so, as employers, as those who understand what public service means, we needed to do what was necessary in the interest of public health. Public service is designed to complement public health and not compromise public health.
Okay. I read in a lot of places the rate for herd immunity is about 70%.
Right.
So where were we in the city with the employees?
Well, it depends on which department you are thinking about, but overall we are just above 50%. And frankly, we have 50,000 employees in the city of Los Angeles, and we have a number of other contract employees or contract relationships. Therefore, we are making it mandatory for all of those,
including the contractors.
That's right. And what we mean by contractors, most specifically when we do security and janitorial services and so forth. So it's really those who are functioning as employees, but through contracts rather than direct employees of the city of Los Angeles.
I definitely understand the reasoning, but there are some people who say this is a violation of their civil rights, their personal rights. So how do you respond to that? We choose not to violate anyone's rights as human beings, as persons who are to be able to enjoy certain freedoms associated with being residents and or citizens of a democratic society. But there are points in which the claim about rights from a privacy point of view, from a civil libertarian point of view, collide with the rights that a community ought to enjoy in terms of standards of public health. And I believe it's a misplaced debate to force the issue in that manner. I want to be safe, I want to be healthy, and I want to enjoy the full range of rights that ought to be accorded to us as those who reside in Los Angeles, those of us who reside in California, those of us who reside in the United States of America. We can do both, but we cannot allow anyone, for reasons that can't be substantiated, to square with health and well-being, to compromise the health and well-being of others. Children, elderly, patients, employees. We cannot do that as responsible public officials. And there are some exemptions.
There are exemptions, and they are exemptions that are accorded those who have permission from their physicians. There are exemptions that are accorded those who stand on religious principles. I take note of the fact that there are
religious institutions that I saw communicate, come here and I'll write you a letter and you can be exempt from it. Well, from my point of view, I choose not to question or trifle with anyone's expression of religious liberty. I just simply hope that they won't exploit the moment by saying that they are a child of God, whatever God that might be, in order to avoid being responsible and run the risk of infecting me and or others who work with them and or who they are supposed to serve in the public. I would hope that that wouldn't be the case.
Hopefully they'll see this and they will heed your warning advice. Let's talk a little bit about your district. What have you been doing to bring attention in the district about COVID and to get people vaccinated?
Well, first of all, we pushed very quickly and forcefully to say that we don't want any more individuals testing positive in the 10th district, and we don't want any more deaths. We had seen more such individuals than I would care to mention, and such is the case throughout the county of Los Angeles. We just recently reached 25,000. That's nothing to ignore. That's a significant number of deaths. And so we began testing. We began the work of setting up clinics, mobile and otherwise, for vaccinations. We have engaged in massive mask, face covering distributions. We've done all the things that we've been required to do and more. We've done public service announcements on a number of airways. We have just tried to be as responsible as we could be, according to the science, according to the best information available to us on the part of the public health officers in the county of Los Angeles, and we will not let up. We've done everything other than try to shame people.
Yeah.
We've done everything other than engage in fisticuffs with people. We've tried to say it's in your best interest, the interest of those you love, to be vaccinated. And we will continue to do that until we get to a better place with respect to these numbers. It's just really important.
It is, and you've been very active on Twitter. I've
Right.
seen your tweets spreading the word
Right.
To your constituents. So now let's talk a little bit about homelessness. You did vote for the restrictions on sidewalk encampments. Why did you cast that vote?
My objective in advancing a perspective that says that there has to be accountability for the uptick in homelessness in the city of Los Angeles. And I think a couple of things have to happen. We need to address this crisis from the vantage point of care, from the vantage point of compassion, and from the vantage point of compliance. All three: care, compassion, and compliance. And the enforcement perspective has often meant mostly compliance, but that doesn't get the job done. The only thing it does is potentially incarcerate people, which we know doesn't work, and it moves them around from one corner to the next, and all of that. That doesn't get it done. The residents of the city of Los Angeles expect us to do much better than we have done, and therefore we need to have policies ensconced in the right to housing. We need to have a right to housing strategy that is operationalized, that deals with prevention, interim housing, permanent housing, and street engagement. And the street engagement means that before there is any talk of enforcement, we will have exhausted the menu of things that needs to be done to get people off the streets into suitable housing. Nothing else will work. And my vote was designed to set that scenario up. And in a matter of weeks, you'll see the adoption, I believe, of the street engagement strategy,
Yes.
where we have nurses, where we have social workers, housing navigators, and the like, not police officers, working with people in ways that this city has not seen. That's what must happen. And I'm very excited about the potential for that to happen from Council Districts 1 through 15. We have modeled it in Leimert Park. We essentially caused some 75 people to be moved into housing, and we did it without law enforcement presence. And it's smarter to do it that way. It's more results oriented to do it that way. The same is the case at Venice and David. We worked with that community, two different providers. On the one hand, Hopics, on the other hand, the people concerned. Just like in Venice, at Venice Beach, there was the St. Joseph Center that did that work. Urban Alchemy and the instance of Echo Park. So there are a lot of different providers, and we need to make them stronger, and then we need to be deeper with them. We need more interventionists in this work. We need more mediators in this work. All of this is critical.
What other neighborhoods in your district will be focused on under the strategy?
Koreatown, for example, 6th and Berendo. And so we have identified those areas that have particularly intense examples of encampments, and we will go to work. We have already begun to show that this does work, and it takes resources, it takes the proper personnel, it takes a determined and committed community. But I have to tell you, it is simply incorrect to suggest that people do not wish to leave the encampments, and those encampments are where they think they belong. Our experiences are just the opposite. When afforded the opportunity to get the kind of attention in the context of a housing circumstance, and it's a range of housing, so it's not one, vouchers, motel conversions, name them, the bridge home, a lot of options out there, not just one. We don't do one size fits all. And so to the extent that that's the case, we see that they will move. At Leimert Park,
Most of them, because I have interviewed a few
Yeah.
who said they absolutely did not want to be sheltered.
Right. And let me just say on that point, once we have exhausted the opportunities for them to be afforded housing, then they have to come to appreciate that they are not to be afforded an opportunity to drive down the quality of life of a particular neighborhood or resident. Can't do that. And I think when that message is delivered by the proper entities, in many instances that's the nonprofits, that's that nurse, that's that social worker, that's the person with lived experience, it's the housing navigator. They get the message, but it's not after one interaction. It's not like you show up or else. No, this is trust building. This is trying to meet them where they are. This is seen through a trauma-informed lens. The very things that police officers are not obliged to do because they're not trained to do it.
Okay.
But if someone is engaged in violent activity, that's the role of law enforcement, not the role of a social worker. This is very well thought out, practical ways of causing us to reclaim these streets and restore dignity to the communities that are impacted, restore a level of civility in those environments, and get people the help that they need and deserve so that lives can be returned to a sense of purpose and worth. No one really wants to be on those streets. And it's our obligation to make sure that they get the help that they need.
That makes total sense what you're saying. What's been the reaction from your constituents to what is currently happening?
Well, I can tell you that the instances in which people have seen those encampments come down, they are, number one, surprised. We never thought it could happen. And two, they are elated. And three, a little wary that they may return, which is in fact what often happens. And so the work has to continue to take place because, as you mentioned, not only is it the case that some said, no, I don't want to leave. Yeah. We've run into that. But once they do leave and go into a housing situation, they leave the housing situation and return to the area of the encampment, only to find that it's no longer there in one instance, and they repopulate. Our job is to say, no, 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 no. That's not what we are prepared to accommodate. What is it we can do to cause you to be committed to stay in a housing situation that you can get better? Whether it's mental distress, whether it's substance use, that's what needs to happen. But you can't put them in jail. The U.S. Justice Department has made it clear. When people are packed into the jails, which in the county of Los Angeles happens to be the largest mental health ward in the whole country, imagine that, LA County jail system. If in fact you load them into that environment, the only thing that you ultimately get is a circumstance where you compound their mental disorders. Written right there in the executive summary of the U.S. Justice Department's report in its review of LA County jail system. So jail is not the answer. We often say you can't get well in a cell. We need to help people get well for our own best interests, and it's far more cost effective, Anita, for them to be in residential environments with case management, with service supports, and the city of Los Angeles and the county of Los Angeles have to commit themselves to working together more collaboratively for the goal and vision of restoring the level of decency that those individuals and those communities in which they find themselves deserve.
And for those who don't know, you were previously a county supervisor, so you've seen this from both sides.
That's correct.
Okay.
Right.
Let's change gears a little bit because we're running out of time. What are some of the positive things that are really going on in CD10 that constituents can get excited about?
Well, we have a lot of wonderful activities going on. I mentioned Leimert Park because Leimert Park is about to see the opening of the new Vision Theater. Leimert Park has already seen the restoration of the Plaza Park there. The merchants are coming back up from under the weight of the pandemic. We'll see street beautification and a whole range of things. The vendors are having themselves a good time, and so it's a lot going on there. And there's a little library that's been closed for 21 years. It's the Irving Branch Library on Arlington, just north of Washington. 21 years closed, a library. I believe literacy is fundamentally important to the civic health of a community. And so we're working very forcefully to make sure that library sees a new day. And people are very excited about that. The Michelle and Barack Obama Sports Complex is under development and about to present itself at the Rancho La Cienega Park Complex. So there's just a number of wonderful things that are happening, vibrance in the space that we call the 10th District. We're very proud of that. The Koreatown community, it will see a new entry, culturally appointed entry to Koreatown that they've been working on for the past several years. We're committed to seeing that through. And so when we think about Debbie Allen and Norm Nixon, when we think about Lula Washington, and when we think about Wendy Raquel Robinson, all of these and more are in the 10th District, from the Lula Washington Dance Theater to the Debbie Allen Dance Academy to Amazing Grace Conservatory, which is Wendy Raquel Robinson's outfit. Listen, there's culture and commerce in the 10th Council District, and we're very proud of it.
Sounds like a lot of culture and a lot of, you named some pretty big name celebrities there.
Yeah, they're right there. They're with us. And they stood up on COVID with us and tried to be a part of the education process for our community and advocacy. So I just have to tell you, I couldn't be more proud of what's going on. We're working very hard, and we're seeing good results.
Well, it sounds like a lot of great things, and for more information, stay tuned to your Twitter feed, correct?
That's right. All day long.
Well, I would be remiss if I did not ask, you recently informed folks that you will not be running for mayor, which we had anticipated. What brought you to that decision?
Life, as we know it. I've been an elected official for 30 years, and there's a significant body of work to give evidence to the fact that I have worked very hard. And being mayor requires a lot. It means you have to work on multiple fronts, from the Los Angeles Police Department to the Los Angeles Fire Department to DWP to the airport to the harbor, and that's just the short list. And I wish to focus my energies and attention on homelessness. It is the defining issue in the city of Los Angeles. And I choose to be hands-on in a way that a mayor cannot, largely because a mayor has to work on all these other issues. I've expended considerable capital, political capital, in trying to drive this discussion forward. And I think it would be disadvantageous, if not counterproductive, for me to take the next 15 months away from working on this issue of homelessness at this point in time. It's a critical point in time that we need to drive it forward, and I'm committed to that. Now, you mentioned that I served on the Board of Supervisors for more than a decade. And having done that, served essentially at the executive, legislative, and quasi-judicial role, all in one. I know what it looks like. I've seen it. And perhaps had I not had the benefit of that extraordinary experience, running for mayor would be more enticing and more inviting. But having done that and doing what I'm doing now, I think I will have done what any one person can reasonably contribute, and it's time to do some other things.
Well, that makes absolute sense, and everyone I talk to says homelessness is the biggest issue for them as city residents.
Right.
Have you decided who you are going to support? Some of your colleagues are running.
Right. Decision hasn't been definitively made, and I know that there's a lot of conversation about Congresswoman Karen Bass contemplating entering the race. I would simply say the following with respect to that. We've had a 40-year history of involvement, starting in the 70s, working on issues in the 80s around the public health crisis of crack cocaine, all the way up to the current discussion about George Floyd and police accountability. I know that she's concerned about homelessness. She's a history maker in her own right. If she were to step forward and prevail as mayor of the city of Los Angeles, she will have made history again. I think her candidacy would be compelling, and Los Angeles would be well to see her as its leader.
Mm-hmm. Wow. Well, she has not officially entered the race, but
Correct.
that sounds like an endorsement to me.
You can't endorse someone who hasn't entered the race. Stay tuned.
Only time will tell.
Stay tuned.
Well, this has been a very lively conversation. Councilman Mark Ridley-Thomas, thank you so much for joining us today.
Thank you.
And I am Anita Bennett, and thank you for watching LA Currents.